What will it take to stay ahead of malaria in Kenya? Hear from experts at the Center for Epidemiological Modeling and Analysis as they share data-driven strategies and practical approaches to strengthen malaria control and protect communities.
So over the years, there have been a lot of progress by the Ministry of Health on the interventions and deploying them to the population. So there are so many interventions that are currently in place, but I'm going to mention just but a few. So we have the insecticide treated nets, which are the normal nets that we normally use in our homes at the beds. And these these nets are normally used to prevent the contact between the humans and the mosquitoes, and therefore it reduces the transfer of malaria from the most infected mosquitoes to the human beings. We also have indoor residue sprays, and these indoor residue sprays are insecticides that are sprayed into the walls of the house, and therefore when they get in contact with the mosquitoes, they'll kill the mosquitoes, and therefore the mosquito population is going to be low, and therefore that reduces the transfer of malaria again to the population. We also have the vaccines that have recently been introduced, and we have RTSS and R21 matrix. So for RTSS, it's normally given to kids younger than 3 years of age, and it's given in 4 doses, the 4th dose being a booster dose. These vaccines are very efficient in the reduction of incidence among the younger population.
While we have already effective interventions like for prevention and treatment, like insecticide-treated nets, indoor spraying, vaccination, chemoprevention, case management, and so on, we still have cases, and we are still far from 2030 elimination, which is the WHO target. There is a lot of reasons behind this, and one of the main reasons is that we need to ask ourselves the question: how do we use these effective interventions on the smartest way possible, given limited resources? During my work here in CEMA with the malaria team, we explored one of these questions by using that data and modeling to assess the impact and cost effectiveness of different malaria interventions across high and very high burden counties here in Kenya. And what we have found, it's very insightful, because maybe for the people who are in the field, there is some mosquitoes resistance in the sites. So that's why WHO has recommended the use of new generation of nets, which are known as dual active ingredient nets, and which can tackle this distant challenge and significantly reduce the malaria transmission. So, based on our findings, we have reported that the use of these new nets is effective and cost effective, because they can reduce malaria transmission and even replace some most expensive interventions like indoor spraying in some cases, and they are still reporting strong health outcomes. So overall, what I can say, based on what we have worked in, is that it's about what works. It's not about just what works, but what works best for the cost. Because especially, given in the presence of limited budget and limited constraints, we need to link malaria interventions with the cost effectiveness in order maybe to maximize the impact, maybe reach more people and to save more lives. And we need to put more collaborative efforts as modelers, data scientists, biologists, epidemiologists, to provide more evidence and to maybe prioritize smarter and data-driven decisions to help maybe local policy makers, such as national malaria control programs, in order to strengthen malaria control and move faster to elimination.
Local data sources provide big advantages compared to global data sets. One of the biggest challenges in malaria we have is availability of local data. The advantage we have, especially in places like Kenya, is this data is available at the subnational level. And why is this important? Is because it provides context and what is currently happening at the lowest level possible of decision making, which in our country is at the sub-county level. Hence, having local data that reflects what is currently happening at that level provides more context, especially because malaria risk is not homogeneous across the country. It is very heterogeneous from county to county and even from sub-county to sub-county. So local data provides a very good context in terms of what is currently happening at the subnational level, which is at the lowest level that is required to sort of plan for interventions, implementation for malaria programming. And this is what we call subnational tailoring. That is currently spearheaded by WHO and adopted by all, expected to be adopted by all malaria endemic countries. And in Kenya, we currently target interventions based on this local data at the lowest level, which is at the subnational level. And that is what, data prioritization or subnational targeting using data provides for us as a country.